Well, the Health Minister, Edwin Poots, joins us now. Very good evening to you. This sounds very like what Michael McGimpsey was saying before the election.
Well, I think the problem with Michael McGimpsey was that whilst there was finances identified that there was a gap needed to be filled, he didn't do anything about it. And specifically, his civil servants weren't given any instructions or direction to save money. So we find ourselves 3 months into the process where we're having to identify these savings, which makes it considerably more difficult.
Jamie's report outlined some of the savings that need to be made there. A key question that people will be asking tonight is, are there going to be job cuts?
Well, I think that there will be job reductions. I don't think there'll be compulsory redundancies. And I think that...
Is that because your department can't afford it?
Well, I think that there's quite a lot of people who are retiring from the health service each year, so we will look at their replacements and whether those are absolutely necessary, and where it's not necessary they won't be replaced, and that's a natural way of saving money, which doesn't cost us any money in terms of redundancy. And
is that applicable to this year or over the next number of years?
It'll be applicable over the next number of years, and obviously we will make savings as each year comes through. But leaving savings to one side, what we want to do is drive through better outcomes. Better outcomes for people who take cardiac arrest, better outcomes for people who have strokes, and better outcomes across a whole range of illnesses, including cancers. And we can do that, and whilst at the same time save money.
Will that include free prescriptions for all? Is that something we can still afford?
Well, let's look at that whole issue. It isn't right that currently we're losing out on about £5 million worth of drugs for people who are suffering from arthritis, colitis, Crohn's disease, cystic fibrosis and cancer. So let's see how we can address that and ensure that those treatments can be given to those people who are suffering those illnesses. Surely
with the amount of money that needs to be saved here, you will be looking at bringing charges back in.
All of these things are being looked at, and certainly it's something I'm given consideration to, and also the list of things that are free on prescription. So suntan lotions, some of the painkillers that people are getting, antihistamines, glucosamine, things like that there are things that we will look at, because there are other better drugs that people need and people can afford to buy those.
And will you have to ask the Executive for more money?
Well, we'll see in the monitoring rounds, but at this moment in time we're looking at savings.
OK, Health Minister Edwin Poots, thank you very much indeed.
Thank you.